Now, as I ask you, what happened if two couples get married with sickle cell trait? Do you know what does trait means? A carrier, okay? A carrier of a allele which is abnormal allele that's carried by the person, okay? I mean, if the two person with sickle cell trait get married, okay, first you have to have produced a okay, you have to produce a the either sperm cells or egg cells, okay, and if you produce each of them, as you see, it has one a healthy and one is unhealthy, and after, okay, the rate, okay, of the it's the result will be here, as you see, 50% will be sickle cell trait, okay, right? 21, as you see here, 25 and 25 with sickle cell anemia. That means totally 50%, okay? 25% will be healthy and 25% will be sickle cell anemia, okay, if two sickle cell trait get married, okay? Okay, in the second okay, option, if one normal person get married with a sickle cell trait. Now, as you see, two healthy, okay, okay, cells here, okay, and one is unhealthy here, and once they get married, okay, the offspring of these two couples will be, okay, here 50% normal, okay, and 50% sickle cell trait, okay. You may remember this kind of calculation, okay, from the inheritance of the genes. Okay, now hemoglobin S, which is most common hemoglobinopathies, okay, what happens here, okay, you may remember the mutation, okay, the point mutation, okay, in the polypeptide change of the hemoglobin, okay, only one amino acid is replaced. The glutamine replaced with the valine, okay, glutamine is acidic, it's charged amino acids, okay, but valine is neutral, okay, which affect the structure and the function of the hemoglobin, okay. Hemoglobin S is not effective as the normal hemoglobin, okay. Now, okay, we also have some hemoglobin derivatives, okay, which cause hypoxia, okay, which means lack of oxygen, okay. You won't be able to carry enough oxygen to the blood cells, to the blood tissue cells, okay. Now, there are different derivatives of the hemoglobin, such as carboxyhemoglobin, methemoglobin, hemoglobin cyanide, and sulfhemoglobin. Okay, these are different derivatives of hemoglobin. They, as you see here, carboxyhemoglobin means the combination of hemoglobin with carbon monoxide. Okay, and carbon monoxide has affinity. Okay, is affinity 100 times higher than normal than oxygen, and therefore, okay, once the carboxyhemoglobin, the carbon monoxide bind to the hemoglobin, okay, it won't separate from it, and oxygen is not able to bind it. Okay, it is really important health issues. Okay, in terms of the carbon monoxide poisoning. Okay, the methemoglobin, other derivatives, okay, it's also affect the binding of the oxygen to the hemoglobin, and there are some other kind we see here. Now, okay, the variation of hemoglobin concentration is also changeable. The reference or normal value of hemoglobin peripheral blood vary with age and gender. And also altitude will affect the number of the hemoglobin, the concentration of the hemoglobin. Okay, the normal hemoglobin concentration is higher at the high altitudes than at sea level, because at the higher altitudes, there is a lack of oxygen. Okay, the percentage of oxygen in air that we inspirate is lower, and therefore okay, the need of the body, okay, for oxygen should be met via the number of the hemoglobins, the concentration. The body will increase the concentration of the hemoglobin in order to meet the need of the oxygen for the tissue cells. Okay, when the hemoglobin value is below the normal, the patient is said to be anemic. Okay, anemia, and in anemia, the circulating erythrocyte may be deficient in the number, in the total hemoglobin content per units of the volume. Okay, either the number of the erythrocytes will decrease, or the total content of the hemoglobin will decrease, or both of them will change. Okay, we call anemia. Okay, increase in hemoglobin can be seen in polycythemia, which we call polycythemia vera. Okay, and in newborns also the number of the hemoglobin erythrocytes is higher than adults. Okay, now it's your turn to send an answer to these questions. Which of following is essential to the oxygen carrying capacity of a molecule of hemoglobin? Globin, heme, iron, bilirubin. Okay, keep in mind, all of them are associated with hemoglobin, with erythrocyte, but one of them is essential to bind, to make a combination with oxygen. Okay, without it, you cannot carry oxygen. Okay, send your answer. Hey guys, are you there? Are we alive? Tricky question, right? Just I'm waiting. We have to go ahead, go forward. We have a lot of stuff for today and tomorrow. Nobody willing to send answers? Or something wrong with my app? Okay, I'm going to skip that if you don't send answers. Okay. The blood cells responsible for carrying oxygen are, it is really easy. You have to know that. Which cells carry oxygen in our body? Guys, are you there? Let me know if something wrong with my app, with Poll Everywhere. Okay, at least one of you send answers. Okay. It is not good for me. Okay, you don't interested in my lectures. Okay, no, platelets, no, erythrocytes carry oxygen, right? Just we are talking about erythrocyte in the last 1 hour. Okay, but okay, no worry, send your response. Okay, we are going to learn better via these questions. If you send answers to this question, I am going to explain it. Otherwise, I am going to skip them. Okay, now the disorder of heme synthesis known as, okay, the disorder, the diseases related to the heme production. Okay, one more. Okay. Thank you. Let's see. Hemoglobinopathies, okay, is the correct answer. Okay. The thalassemia is the underproduction of the globin. Okay. It is related to globin. Okay. Porphyria is disorder of the porphyrin rings. The synthesis of the porphyrin is affected, okay? And hemoglobinopathy, as the name implies, okay, hemoglobinopathies, okay, is related to the disorder of the heme production, okay? Agree with me? If don't, please let me know. Okay, deficiency of which of the following elements result in anemia? Magnesium, iron, calcium, iodide, none of above. It is also a really easy question, right? Okay, go ahead, send your answer. Okay, let's see. Iron is correct answer. Good. Okay, which of following variant of hemoglobin exists in normal adults? Hemoglobin F, A, S, C. The hemoglobin that we see in normal adults, in normal person, okay? In adults. Okay, let's see. Okay, A, E, okay, in normal adults, S in abnormal adults, right? The correct answer is B, okay? You have to read the question carefully, okay? Now, what is the probability of sickle cell anemia if two persons with sickle cell trait get married? Okay, I may change this question to ask you if two sickle cell patients get married, maybe. The probability, okay, of sickle cell anemia, okay? Sickle cell anemia is different from sickle cell trait. Okay, let's see. Okay. It's supposed to be 50%. Okay. A sickle cell trait has one normal each person and one healthy, one unhealthy allele. Okay. And this allele will combine. Okay. You first have to produce a okay, the sperm cells or eggs, okay, one will be normal, other will be unhealthy, and the correct answer is supposed to be B. I'm going to show you the correct one. Okay, oh, is A. Okay, the correct answer is 25%. Yeah, I mean B is person with sickle cell trait get married. Okay, I'm gonna double check it, but is no, its correct answer is A. Okay. Sickle cell anemia 2. What is the probability of? Okay. I need to double check it. Okay. Let me know if you not agree with these answers. Okay.
Wouldn't it be B for 50%?
Yeah, I guess it should be B. Okay, because two persons with sickle cell trait. Okay, once they get married, 50% will be sickle cell trait. Okay, 21, 25 will be healthy, 25 will be the probability. Okay, will be sickle cell anemia. Okay, uh, I would choose the B. Okay, but I am going to double check it later. Okay. Okay, now you already see these pictures, okay, which summarize hematopoiesis, the production of the blood cells. We already talked about the production of the erythrocyte, the structure and the function of erythrocytes. Now I am going to start with this production of the leukocytes, white blood cells, and their structure and function and dysfunction of the leukocytes. Now, as you see here, okay, right, I am going to get my laser pointer. Okay, now the stem cells differentiate into cells, myeloid stem cells and lymphoid stem cells. Okay, and these myeloid stem cells it differentiate to megakaryocytes, which give rise to platelets. Okay, the cells which related to clotting, blood clotting. Okay, and then granulocytes precursor, erythrocyte precursor, monocytes. Okay, and uh, also is differentiated to lymphoid stem cells, um, which result in production of B cells and T cells. Okay. Now we are going to discuss the white blood cells. Okay, and their production and their function. Okay, now leukocytes or white blood cells, okay, and okay, they also formed in bone marrow, okay. As the cell mature, they are able to move through the sinusoids here, okay. Uh, okay, the pores, okay, where the cells can squeezing through, okay, in the bone marrow, okay, and then come into the blood circulation, okay. As the cell mature, okay, they are able to move through the sinusoid of the bone marrow, okay, and because of the decrease overall the size and increased flexibility and mobility of the cells, okay. And normal peripheral cells include lymphocytes, basophil, eosinophil, segment neutrophil, monocytes, and the band neutrophil. I'm going to show them, each of them, step by step. Each cell type has a normal lifespan and function, okay? We have to know the function and the structure of each cells. However, they, okay, they rise in the bone marrow from myeloid stem cells. Now, as you see here, okay, normally only mature cells are seen in the peripheral blood circulation. Okay, you don't see the myeloid, the precursor of the white blood cells in the blood circulation in normal healthy cells. However, immature cells may appear in the peripheral blood in the certain disease states, such as leukemia or bacterial infection or viral infection. And this called a shift to the left. Shift to the left means there are some immature cells in the peripheral blood circulation, okay, which tell us that there is either some kind of leukemia, okay, or infection disease. And now you see here, okay, the maturation of the leukocytes, uh, okay, white blood cells, okay, uh, from the youngest to the most mature here. And okay, the name, you don't need to memorize the name of each these leukocytes. However, we have to know that as they mature, okay, the size of the cells, okay, the size of the nucleus becomes smaller, okay, and then also they have some granules by the time, okay. I'm going to show them. Okay, now, as I said here, as the cells mature, they become smaller, and then also as the cells mature from the myeloblasts to the promyelocyte stage, non-specific granules that stain blue, okay, to the reddish purple, okay, they appears in the cytoplasma, as you see the cytoplasma of the white blood cells. Okay. Okay. The nucleoli maybe disappear once they get mature. Okay. Okay. Now let's know each type of the leukocytes, the white blood cells in the peripheral blood, in the blood circulation. If you examine a drop of the blood under a microscope, you will see 5 types of the leukocytes, okay, of the white blood cells. These are neutrophils, eosinophils, basophil, monocyte, and lymphocytes. I am going to show the picture of each cells. We have to know the, the, the structure, okay, the appearance of the white blood cell of the neutrophil, lymphocytes, and erythrocytes. Okay, as you see here now, these are erythrocytes. Okay, you see here, these may be platelets, and this is lymphocytes, and this is neutrophil. Okay, multi-lobal nucleotides. Okay, I'm going to show you other pictures. Okay, now the characteristics of the neutrophils. Okay, there are 5 types of the leukocytes in the blood circulation. The the most common is the most numerous of the granulocytes in the peripheral blood are neutrophils. Okay, and the neutrophil granules contain several digestive enzymes that destroy many types of bacteria. Okay, when they encounter the bacteria, they will engulf the bacteria and digest it with the enzymes. Okay, the cells are capable of random locomotion and then can be directed to the area of the infection by the process of chemotaxis. Okay, and they once they in the tissue, these neutrophils they become a phagocytes and they will engulf uh, bacteria, and then they will destroy these bacteria via enzymes, via digestive enzymes that included in the neutrophils. Now, eosinophils are the other type of the white blood cells. Okay, they proliferate in response to immunologic stimuli. Okay, they are active in allergic reactions and certain parasitic infections. Okay, if you uh, if you determine a high percentage of the eosinophil, you may think about the parasitic infections. Okay, now basophils, as you see here, they uh, okay include a lot of granules, basophil granules. These granules contain histamine, heparin, and heparin-like substances. Okay, uh, and basophils are associated with immunoglobulin E-dependent immune responses. If the same events are triggered by uh, antigens from pollen, foods, drug, or insect venom, the result is a disorder of immediate hypersensitivity, okay, as allergic reactions, okay, which develop quickly, okay, after second encounter. Okay, now you see the structure of white blood cells. As I said, you may be familiar with the structure of neutrophils, okay, as you see here, okay, the polynucleated cells, and lymphocytes, it has only one nucleus, a big nucleus, okay, and the structure of the erythrocyte, which we don't see here. Okay, okay, I have a few minutes for a few, 1 minute, a few, okay, now, okay. We classify white blood cells as a granulocytes, okay, and agranulocytes, okay. The cells which include uh, granules, okay, are neutrophil, eosinophil, and basophil, okay, and the cells which don't contain granules, which is known agranules white blood cells. These are monocytes and lymphocytes. Now, as you see the structure of the leukocytes, white blood cell again, okay, okay, the neutrophil, basophil, eosinophil, basophil, okay, They also known polymorph nuclear granulocytes. Okay, these are monocytes and lymphocytes are mononuclear granulocytes. There is no granule in their cytoplasma, and they include only one nucleus. Okay. Now let's talk the function of each single white blood cells. Okay, neutrophils are phagocytic cells that ingest bacteria and dead cells, debris. Okay, and eosinophils contain lysosome with enzyme that degrades cell membrane of the parasitic worms. Okay, eosinophils are related to the parasitic infections, and basophils release histamine in injured tissue and in allergic responses. And they also, the granules contain heparin and heparin-like substances. You know, heparin is anticoagulants, right? And these are related to the allergic responses. Okay, now agranular leukocytes are either monocytes and lymphocytes. Monocytes are phagocytes that migrate from blood into the tissue during an infection. They differentiate into the phagocytes into the macrophage that engulf bacteria, dead cells, debris, and then they will break down these via digestive enzymes. Okay, we also have dendritic cells and lymphocytes, okay, which are either B cells and T cells. They also fight with infection agents, okay. Some produce, B cells produce antibodies, and T cells, they directly attack invaders such as bacteria and viruses. Okay, now I am going to finish with these questions, and then we'll continue tomorrow. Okay, let's send your answers to these questions. Okay, which of the following examination result is not diagnostic criteria for bacterial infections? Okay, fever, increased macrophage, increased lymphocyte, increased monocyte, increased neutrophils. Okay, one of these is related to viral infections mainly. Others related to bacterial infections. Let's see. I didn't mention it before. Okay, increased lymphocytes, okay? Increased lymphocyte is associated with viral infections mainly. Okay, if you get a result of the peripheral blood count and see the lymphocytes are increased, okay, predominantly, you may predict that there is a viral infection instead of bacterial infection. Okay. Okay. Next one. To make a differential diagnosis for bacterial
Dr. Adam,
yeah.
I'm sorry, what was the correct answer for the last question?
It was C. Okay. C is related to viral infection, not bacterial infections, predominantly. Okay. Among these options, you have to choose the lymphocyte, increased lymphocytes. Okay. Okay. Now here, to make a differential diagnosis for bacterial infections, which of the following laboratory tests you should request? Blood glucose, leukocytes, bilirubin, pH, sodium, lymphocyte. Okay. No, leukocytes are, okay, the cells which fight with bacteria mainly, okay? The correct answer is B. Okay, which of the following cells is responsible for allergic responses? Neutrophil, lymphocyte, eosinophil, platelet, basophil. Let's see. Eosinophil. I will choose the basophil. Okay, the correct answer is basophil. Okay. Okay, now, which of following cell is not included in normal peripheral blood? Lymphocyte, eosinophil, myelocyte, neutrophil, none of above. One of them is included in bone marrow, not in the peripheral cells, blood. Okay, show myelocytes, the correct answer. Neutrophils, the most common cells in the peripheral blood, in the blood circulation. Okay, the correct answer is C. Okay, this is last one. Like once in the tissue, which of the following cells destroy bacteria by engulfing them and releasing digestive enzymes? If you pay attention, which one, Patty?
White blood cells.
White blood cells, but which kind? Okay. Correct, white blood cells. Okay. My grandsons give the correct answer. Okay. The correct answer is neutrophils. Okay. If you see the bacteria, okay, lymphocytes also fight with bacteria, but the neutrophils, okay, they enter into the tissue and become a macrophage, engulf bacteria and kill them. Okay, it should be enough for today.